Hi, this is John Cielo of thegoutsite.com. Welcome to Making Sense of Gout, because knowing is half the battle. Today's topic is an overview of gout medications. You'll discover drugs used to treat the symptoms of an attack, drugs used to manage gout long-term, how they work and their benefits, common side effects, potentially fatal allergic reactions, and which drugs should be stopped during an attack. When you have gout, you have it for life. There's no known cure. However, it can be managed to prevent repeat gout attacks or, at the very least, to greatly lower the risk of them occurring. Which is why, when you have gout, doctors usually prescribe two different types of medications. The first to relieve the pain and inflammation of an attack. The second to prevent further gout attacks, by managing uric acid levels. Gout medication generally falls into four types. Non-steroidal anti-inflammatory drugs, NSAIDs for short. Colchicine, corticosteroids, urate-lowering drugs. The first three are for relieving the inflammation and pain of a gout attack. The fourth is for long-term gout management. NSAIDs are the most commonly used drugs for treating gout attacks. NSAIDs like ibuprofen, indomethacin, naproxen, and diclofenac are non-steroidal drugs used to reduce inflammation and help relieve pain. They can't reduce uric acid levels, so are only of use during an attack, not to prevent further attacks. They can be pretty effective, but they can also have some negative side effects, like stomach pain, bleeding and stomach ulcers, headaches, dizziness, tinnitus, hypertension, and rashes. Now an important word on aspirin. Aspirin is an NSAID. However, aspirin has certain characteristics that make it unsuitable for treating the inflammation and pain of a gout attack. It's known that aspirin can increase uric acid levels by reducing the kidney's ability to excrete uric acid. Therefore, taking aspirin at the onset of, or during a gout attack, will only exacerbate the symptoms. So doctors generally don't recommend aspirin for gout. But what if you have to take low-dose aspirin for another medical condition? At least one study has shown that those on a medicinal low-dose aspirin, and who also have gout, are at a higher risk of having recurring attacks. However, the study's authors recommend that aspirin should not be stopped, but rather, the patient's uric acid levels should be closely monitored and controlled by urate-lowering drugs. So, if you take low-dose aspirin to help reduce the risk of heart disease and stroke, and this is your first gout attack, or even a recurrent attack, do not stop taking your aspirin. Instead, talk to your doctor about closely monitored urate-lowering therapy, alongside your anti-clotting aspirin. Colchicine. Where a patient can't take NSAIDs safely, or where they've been found to be largely ineffective for them, then colchicine may be prescribed instead. It helps to relieve pain by reducing the white blood cell count in the inflamed area. Colchicine can work pretty quickly, especially if taken within 12 hours of the onset of a gout attack. But, it has some pretty nasty side effects, like nausea, vomiting, diarrhea, abdominal pain, and stomach cramps. Corticosteroids. Where a patient can't take NSAIDs or colchicines, then corticosteroids, such as prednisone, can be prescribed. Corticosteroids are anti-inflammatory steroid hormones that can be taken orally or by injection during an attack. They work by acting on the immune system to help block the triggering of the body's own inflammatory reaction. They can eliminate all symptoms within a week or thereabouts. But, because of the way they act on the immune system, a serious side effect is that the ability of the body to battle infections, and heal open wounds, is compromised. Other side effects include, weight gain, insomnia, fluid retention, and mood changes, like feeling irritable or anxious. Urate-lowering drugs. First, we need to look again at the causes of gout. To understand why urate-lowering drugs are needed to manage gout, let's quickly remind ourselves of its root cause. Gout is caused by higher than normal uric acid in the bloodstream, a condition called hyperuricemia, out of which uric crystals form in the joints and associated tissue. These microscopic, needle-like crystals, trigger an inflammatory response, which gives rise to the typical gout attack symptoms of swelling, inflammation, redness, warmth, and excruciating pain. Urate-lowering drugs are used to help reduce, and then maintain uric acid at healthy levels, to help prevent further attacks. For the reduction and maintenance of uric acid, urate-lowering drugs like allopurinol, febuxostat and probenecid have proved effective. Allopurinol and febuxostat come from the class of drugs called xanthine oxidase inhibitors, which impedes the release of xanthine oxidase, an enzyme that aids in the breakdown of purines, and the formation of uric acid. Another common urate-lowering medication is probenecid, from the class of drugs called uricosurics. This works by increasing uric acid excretion in the urine, which in turn, results in reduced blood uric acid levels. Urate-lowering medications have to be taken continuously, as they can only work while being taken. In other words, if they are stopped, uric acid levels can rise again. So anyone prescribed these drugs, is usually advised to take them for life. They can have side effects like headaches, diarrhea, nausea, stomach upset, joint pain, muscle pain, skin rash, even kidney stones with probenecid. Let's summarize. For gout relief, NSAIDs such as ibuprofen, indomethacin, naproxen, and diclofenac are the most commonly prescribed medications, to help relieve gout attacks. Where NSAIDs can't be used, then colchicine can be prescribed. Corticosteroids, such as prednisone, can be given where neither NSAIDs, nor colchicine, are appropriate. For gout management, once you have gout you have it for life. But it can be managed, by taking urate-lowering drugs such as allopurinol, febuxostat and probenecid. These only work while being taken, so are usually taken for life. Typical side effects. Depending on the drug, typical side effects include nausea, vomiting, bloating, diarrhea, constipation, headaches, dizziness, tinnitus, abdominal pain, stomach cramps, bleeding and stomach ulcers, hypertension, weight gain, insomnia, fluid retention, mood swings, joint pain, muscle pain, skin rash, poor wound healing, and kidney stones. This list is not complete, but gives you a good idea of the wide range of side effects that gout drugs can have. Talk to your doctor or pharmacist about each of your drug's side effects. In addition, the actual side effects for a particular gout drug will be listed in the fact sheet inside the packaging, which you need to read very carefully. However, there are some reactions that can be life-threatening. Medical professionals advise that medication should be stopped immediately, and emergency medical help sought, at the first sign of things, like swelling of the face, itching or tingling inside the mouth, swelling of the mouth or lips, difficulty in swallowing, eye irritation, painful urination, blood in urine, a rash, breathing difficulties, shortness of breath, wheezing, dizziness, lightheadedness, fever. Although rare, these can be signs of a potentially fatal severe allergic reaction to a drug. This is just a short list of possible reactions, so, if in any doubt, always seek medical attention. Should urate-lowering drugs be stopped during an attack? This has always been a controversial issue, although the general consensus is to stop taking them during attacks, because there's a belief that continuing with them makes the attack even more severe and prolonged. However, there's at least one study that showed that taking low-dose allopurinol does not prolong a treated attack. And another study has shown that uric acid levels can rise rapidly when urate-lowering medication is stopped, and can reach pre-treatment levels within a week, irrespective of how long the patient had been taking their allopurinol. Given that study, logic would suggest that to stop taking your urate-lowering medication every time you had a gout attack, would continually set your recovery back to day one. So, the question is, to stop or continue urate-lowering medication during an attack? It's best to contact your doctor and be led by them. They may advise you to stop urate-lowering medicine while treating the symptoms, or they may suggest a reduced dose until the attack abates, depending on which side of the argument they are on. These are just very short summaries of typical gout medications prescribed by doctors. It's very important that you follow your doctor's advice very closely. And never, ever, stop any gout medication without first consulting with your doctor. But are medications enough? Finally, even though gout medications can be effective on their own, they are less so if other gout risk factors aren't taken into account. Which is why most doctors also recommend making some lifestyle and dietary changes. For example, many studies have highlighted things like being overweight, too much alcohol, high purine diet, too much sugar, crash dieting, and long-term stress, as high risk factors for gout. I cover these in detail in the goutsite.com, and I'll tackle them in future videos here. That's all for today. Thanks for watching. Please visit thegoutsite.com for more information. Just click the link in the description below.